During the sessions, all attendees, participants will be on mute. The session is in English. The session will take about 90 minutes, and we request all speakers to take the time allocated for them. And you can put your questions in the chat box in the Q&A sections, and we will respond to them as much as possible. Experience has taught us that we might not be able to respond to all the questions, as we will receive quite a few. But rest assured, we will try to give attention to the majority of the questions. Will it not be in this session, then it might be outside the session, and the speakers can respond to your questions. The answers we will then include in the conference report. Throughout the session, you'll see pop-up questions coming up. We kindly request you to share your answers with us, and I will share the results of the pop-up questions with everybody at the end of the webinar. If you're on Twitter, great. If you feel like, and we encourage you to share your tweets online under the hashtag AHBS2021. Then I want to zoom in a bit on Africa Health Business. We are the organizers of this session, and a bit of information about us. We're a health advising and consulting firm based in Nairobi, Kenya, but we have operations throughout the continent. The services that we provide are focusing on the private health sector on the continent, but that doesn't mean we don't work with other partners. We work a lot with public sector, other private sector partners, but also with development partners, NGOs, CSOs, and faith-based organizations. On the slide, you can see the different services that we offer. And the last but not least is the Africa Health Business Symposium, of which you are participating in one session right now. Then I want to show you the program for today. As I mentioned, about 90 minutes. We have very interesting panelists or speakers that represent the continent, but also the national level of the health space in Africa. Different sectors, public sector, private sector, development partners. So I'm looking forward to learning more from our interesting speakers today. Next slide. Yeah, that's me. I'm Morluski Wacha, Managing Director of Africa Health Business, and I'll be moderating today's session. And before we start the session, I just want to share a slide with an overview of where we are in terms of COVID-19, at least as of 22nd February 2021. There's a map of the world and the COVID cases at that time, about 3 days ago. Data is constantly changing, but we set the date of 22nd for this presentation. You can see here that there were about 111 million confirmed cases. Most likely the amount of cases is a lot higher, but unreported cases or lack of testing it attributes to that. Out of the 111 million, about 2.4 million deaths have unfortunately happened, but also 87 million have survived or recovered. So at the moment, still 22 million active cases. Most cases, as you can see on the map, are in North America, Brazil, Europe, India, but also quite a few in South Africa. When you look at the case fatality rate, you see it's the highest in Yemen at 28.7%, and the least in Qatar, Burundi, and Bhutan at 0.2 and 0.1% respectively. Next slide. Next slide. Yeah, so what are the COVID-19 lessons learned so far? And of course, we'll deep dive into that a bit more during the session. But what we have as AHB have learned or have seen is that a disease or a pandemic doesn't discriminate. It can happen to anybody, anywhere in the world, any color, any ethnicity, any religion. Doesn't matter if you have a lot of money or not. And in order to tackle the disease, the world needs to be solidaire with each other. And in order to be solidaire, partnerships are key. Public sector cannot solve this challenge alone. Private sector cannot do it alone. Development partners cannot do it alone. So there is a need for partnerships. And we've said it a lot in the health space, but it's really true. Prevention is better than cure. And especially in this regard, hygiene, washing hands, wearing face masks, social distancing, it is key. And what is the role of the public sector in that? But is there also a role for the private sector? And of course, you have individual responsibility in that. As we have seen, there are quite some donor funding coming available, especially for the lower and middle income countries to tackle the disease. Governance and transparency is key. The public is aware of the funds coming in through the media and wants to know how is this money being spent, what are priorities, and what do we as the public see in return for the funds being donated. And another key aspect that we believe as AHB is key is the continental strategy with actions and support. And I'm very happy that we have Dr. Ogwell in the session today on behalf of the Africa CDC, who has really been at the forefront of the continental strategy and driving really action and impact in this regard on the continent. And looking forward to hearing more from all our speakers through this session. Next slide. So these are the panelists or the speakers of the session. I'm very excited about it. I think they all have key insights and expertise to share with us from different backgrounds and different subsectors of the health space. We will start with Dr. Sengangoy of the WHO, followed by Dr. Ahmed Ogwell of the Africa CDC, then Dr. Mercy Mwangangi of the Kenya Ministry of Health, followed by Dr. Ian Barton, Clinton Health Access Initiative, and last but not least, the private sector, AstraZeneca, Ms. Woodsfield. So I'd like to start with the first speaker, Dr. Sengangoy. You're welcome. I hope you can hear me.
I can hear you, Maris, and thank you very much for inviting us.
Great. Just for the audience, Dr. Senga is a public health and emergency expert with more than 25 years of experience managing outbreaks and other public health emergencies in Africa, working with governments, NGOs, and UN organizations. He's been with the WHO for the last 15 years and been involved in several major outbreaks and public health emergencies across the African continent, including the management of the Ebola outbreaks in West Africa and DRC, and currently serves as the team lead for the Emergency Response Unit in the WHO Regional Office for Africa and for the WHO AFRO's Incident Management for the COVID-19 pandemic. Karibu, Dr. Senga, how are you?
Asante sana, Marlos. Thank you very much.
Good. It's great to see you here. I remember we had a call before the session actually to brief a bit about what the session is going to be about. And I remember you made it very specific. I would like to speak about health security because COVID-19 is not a standalone public pandemic or a disease. It takes place in a health system that needs to juggle with a lot of different diseases, illnesses, and outbreaks. And now, one question that came up is like, how does the WHO emphasize on building resilient health systems in Africa, which also include the provision of non-critical health services? So that's basically my question for you to start with.
No, thank you very much. And thank you so much. And I remember that discussion and you're absolutely right. Unfortunately, Africa in particular in the African region of WHO faces several challenges, including several diseases. For information, maybe for our audience of today, the region of African region of WHO report about 100 to 150 public health event, what we call public health event or public health emergency on health basis. In addition, we have to face other public health issues, including non-communicable diseases and including other health services. So now, before even go, why do we emphasize on having resilient health system? I really liked your introduction that pandemic, outbreak, or diseases, they don't care if you have resources or not, and you have seen it in this pandemic. So, what is a resilient health system? We have heard a lot about this. What is a resilient health system? We have seen during this pandemic that rich countries have actually struggled with the COVID-19. So a resilient health system, when I give the definition, operational definition, it's very simple. Is the system that can provide and continue to provide services, all services, including services related to the emergency, but also other services, even though is also affected by the emergency, by the outbreak, or by the pandemic, as much as any other sector. That's the resilient health system. Now, that's why we emphasize in our region, given our landscape of emergencies, that we need to build health system that can sustain to provide and continue providing services during, after, and before any emergency occur. That's very key. That's a very important in our city because we are exposed to several emergencies. We can't afford to have health systems that are easily disrupted by an emergency. Now, just to refresh you, maybe you might remember that during the Ebola in West Africa that you mentioned during when you introducing, we had even more death related to malaria than to Ebola, which means the health system failed to take care of people suffering from malaria because of the Ebola. So this is why building resilient health system that can continue and should continue providing services before, during, and after emergency is absolutely crucial to our communities.
And what do you as a WHO do at an Africa, maybe country level, to help countries set up those resilient health systems? What is the role of WHO in that process?
Okay, I'll go this way. Now, based on what I gave as a definition for a resilient health system, let's first what happened in our region. Why do we have such a huge number of emergency or public health events? Actually, among those public health events I mentioned, 80% are infectious disease. So what I used to tell my colleagues is, or any other people I discuss with, is these infectious diseases, these outbreaks, they are not spontaneous generation. They emerge because of some of vulnerabilities and some of lack of capacity. That's what I call a perfect recipe for disaster. When you have increased or high vulnerabilities and meeting low capacity, that's a recipe for disaster. And that's where we are. We are having this emergency because they come on the ground of high vulnerability of our communities. So many reasons why our communities, our societies, our populations are vulnerable to infectious disease, but also because of lack of capacity. Now, let me put a caveat here. When I'm talking about capacity, it's not only about resources. And I emphasize, we have seen it, countries with resources, this time, they've struggled. It's not because they don't know what to do. It's not because they don't have resources. They do have resources, but it's because sometimes, or what I call also soft capacity, the way you organize yourself, the way you manage, the policy you put in place. That's why it's even important to address those vulnerabilities beyond the health sector. Again, now answering to your question, how do we build a resilient health system? Of course, the health system, the health sector has a role to play, but it's not only the work of the health sector. WHO is doing a lot in trying to build those health systems through policies, planning, and also, of course, skills and the resources. But it's not enough. We need to also address the vulnerabilities that are outside of the scope of the health sector. And that's why all the communities, all the society, that's why sometimes when we talk about health in all societies, or health in all policies, that's what exactly it means. All the sectors, all the policies, and I'm very happy today the private sector is here. Maybe I'll have a word about the health sector to invest in the health sector, not in the health system, but in the health sector to make the health system resilient in our region. That's how we can build resilient health system. It's not only the work of the health sector alone, it's the whole society responsibility.
Yeah, I think that is really a true answer. And yeah, indeed, we don't operate in a vacuum as a health sector. So many other influences or factors influence the health space. Participants might see actually a pop-up question now. We kindly request you to fill this in. As I said in the introduction, the answers, I will share them with you by the end of the webinar. Thanks for that first very interesting answer and insights. Then I had another question actually, because as you work in the WHO emergency program, and as we said, there's a lot of focus on COVID-19 at the moment, but your team focuses also on other emerging public health threats, such like as now the recent Ebola outbreak again in West Africa. We are wondering, how do you prioritize your focus at the WHO in Africa? Where do you, how do you decide what is a priority and what maybe, that's a bit less attention, or how does it work?
Interesting. Actually, I'll give, we have one priority and only one. That's save lives and preserve health. That's the priority. So whatever happened, we need to pursue only that objective of saving lives and preserving health. That's our objective. So now it's true that we are overstretched. I mean, we are dealing right now as a region because, as you might know, WHO deal with 47 member states, not the 54 of the AU. So we are dealing with all our 47 member states who are affected by the COVID. Meanwhile, we have other emergencies, as you mentioned, Ebola in West Africa, Ebola in DRC. But even within a country like Guinea, right now is affected by Ebola, by the COVID, but is also affected by yellow fever. People might not know this. There is also affected by polio outbreak at the same time. So there is no prioritizing the disease or the event. Is prioritizing how can we save lives. But of course, according to the disease, according to the event, we have to use the appropriate measure, appropriate interventions to deal with that disease. So this is our priority. Our priority is really, and again, that's why I'm coming back to building a resilient system, because if we are better prepared, if our countries are better prepared and our health system are resilient, of course, we lose less lives and we'll preserve better lives.
So, for example, in the case of Ebola, it's very contagious, right? It's very infectious. Even if there might be only 2 or 3 people who are tested positive on Ebola, I can imagine it becomes high in the radio because the potential to spread is maybe a lot higher than cholera at a certain, or the effects are more detrimental. Is that what you also include in your think, your action plan as WHO, or how do you differentiate on that?
Yeah, of course, if we go now into the operation, how do we operationally work as WHO? Yes, when there is an event, we do what we call risk assessment. What is the risk? A risk to the community, risk to the population, but also risk to other countries. We have our tools we use to conduct a risk. And based on the risk assessment, we classify. WHO have our internal classification, which we call grading. We call from grade 1 or grade 0 actually to grade 3. Grade 3 is a disease or an event with high impact, high magnitude, and so on. So for Ebola, for instance, because of some criteria that you mentioned, because of the magnitude, because of the risk of infection, because the risk of spread and the risk of spread regionally, not only nationally, but also regionally, and also the risk for mortality and case fatality. So because of all those interventions, but we also take into account the possibility or the capacity for the country to fight back. Does the country have enough resources? Does the country have enough skills and enough capacity? So based on those, we grade the event. So for instance, Ebola in West Africa has been just graded grade 3, that's the highest. While Ebola in DRC, Eastern DRC, the current one, has been graded grade 2. That's internal grading of WHO. It doesn't mean for other partners anything, but is how we work operationally. How can we support and we grade our resources based on that grading?
Okay, interesting. Thank you so much. I've been informed that you are a very busy man, especially at the current times. I hope you can make it with us till the Q&A session, where we also include some questions from our participants. But if you need to leave us before that, we already thank you for your insights provided so far. I think it's been very useful and valuable. Let's hope you'll still be with us when we have the Q&A section. But for now, thank you so much.
Thank you so much, Malus. It is a pleasure.
We'll now move to the second speaker of the day, Dr. Ahmed Ogwell. Welcome, doctor. How are you?
Very well, thanks, and good. I think it is afternoon for you, and
yes.
Good day to everybody else, wherever they are.
Thank you. Let me give you the participants a brief introduction about who you actually are. I think most people actually in the scene know you because we have seen you in so many other speaking events and active on LinkedIn, social media as a front runner at the Africa CDC. But as you serve as a deputy director at the Africa CDC at the moment, and you have over 25 years of experience in public health and social and development agenda setting at the national, regional, but also global level. Previously, Dr. Ogwa worked as an advisor for the World Health Organization, then Director General, and also at the WHO Office for Africa. We welcome you very much. And it would be interesting for you to get more insight on the African level of what you have experienced at the Africa CDC. Or participants, you see another pop-up question, kindly fill it in, then we'll see the results at the end. I wanted to start with a basic question, but I don't think the answer is that basic. But it's like, what does it take for us to win the battle of COVID-19 in Africa, according to you? What are your views?
No, thanks, and thank you for inviting me to the to this session of this series of seminars. Of the many things that it will take for us to win this battle against COVID-19, I'll pick out three. And these are based on lessons that we've already learned this time and lessons that we learned with the Ebola outbreak of 2014, 2016 out in West Africa. The first thing that it takes is personal discipline. Because COVID-19, the virus responsible for it, SARS-CoV-2, does not jump. It is actually transmitted from person to person. So it is us who actually do the transmission. So if we are disciplined and if we follow the very basic public health measures that have been proven to work, we can be able to beat COVID-19. I like to say that we are the vaccine if we do the right thing. This is the first point. The second is we have to do things in solidarity on this continent, meaning that one country must do more or less the same thing as the next country. One part of the country must do exactly the same thing as another part of the country. If we do things in solidarity, put in place policies that are proven to work, and enforce those policies across board, we will beat COVID-19. The third thing that I will pick out of the many is we must build our continental institutions. We must build our national institutions, those that are relevant for tackling health security issues on the continent and in a country, those that are responsible for ensuring that we can be able to have early detection, rapid response to any outbreak, in this case, the COVID-19 pandemic. So these three things, if we did them, and the last one, if we capacitated these institutions at the local level, at the national level, if we capacitated these institutions at the continental level, and Africa CDC is a good example of one of the institutions that need to be strengthened across the continent, then we will be able to do the right things, have the correct information, have the correct complement of experts tackling this issue, and we will be able to beat COVID-19. So of the many things, these three really stand out for me as not only urgent, but the key cogs in that process of winning against a COVID-19 pandemic.
I think the three of them are key, and they're also achievable. You know, with the right mentality, the right mental, and the action, it is achievable. It's not like out of reach. So it should indeed be something we can achieve. Let's move on to the vaccine discussion that's very currently at the moment, right? As far as we know, all vaccines in Africa are purchased centrally through the public health mechanisms. I'm wondering, what are your views on issues like market authorization and giving private sector also access to or the opportunity to get involved in the vaccine rollouts in Africa? What are your views, or Africa CDC's views on that one?
From our end, we are very clear that we want to vaccinate 60%, at least 60% of the population in Africa. This is the way that we can be able to get herd immunity efficiently. and then go back to, not to indiscipline, but at least go back to our economies working relatively efficiently again. In as far as access to vaccines are concerned, we are in a very unprecedented time. Before, we used to have vaccines being developed over many years, and we used to have vaccines that are targeted largely at very children, not so much adults, and certainly not at this scale. It means that the demand for vaccines is extremely high. And that is why you see vaccine nationalism playing out globally, something that we are totally against. And when the demand is so high, it means that unscrupulous individuals, I don't want to say institutions, though those exist as well, but unscrupulous individuals will want to not only cash in, but they will want to disrupt the more reasonable processes that governments and ourselves as supra-government organizations will have put in place. Now, when we look at the current arrangement, access to vaccines is very difficult. And indeed, the demand far outstrips the supply. It means that there is every opportunity for unscrupulous individuals to bring in what is fake into the market. Indeed, sometimes not just what is fake, but what is not a vaccine at all. And there is need for very close regulatory supervision by national governments to ensure that what is reaching their shores are the correct products and are going to be safe and efficacious. Otherwise, we end up with a huge, huge risk of not being able to control the pandemic. The private sector has a place, and that place must be defined by national governments clearly. And it is our position that the importation of vaccines must be overseen very closely by the government, so that private sector players do not end up bringing in, usually for reasons of supply sources that may not be very well regulated, wherever it is that they're getting them from. So the national government must very closely monitor if the private sector were to be given that opportunity to import, and I think it is a good idea, but the monitoring, the regulation has to be extremely tight and overseen very closely by the government. Indeed, the private sector has a role to play because we have such a huge population that we are trying to get to. Secondly, and very importantly, the definition of which group should get the vaccine first has to follow what the government has put in place. We don't want a situation where rich kids are getting vaccinations and older, poorer individuals in the society are actually not able to get vaccinated, and yet they're the most vulnerable. So the government must work together with the private sector so that even if the private sector were to be given an opportunity to play a role, they follow the guidance of the government, and the groups that have been identified must be the ones who receive the vaccine first before those that are lower down in the chain of vaccination. So there is opportunity for that to happen, but closely monitored and regulated by the national government.
Okay, very clear. So definitely opportunity for private sector, but I think it depends on the different countries and how that takes form and shape. Participants, another pop-up question. Kindly fill it in. I have another question for you. At least here in Kenya, where I am based, you know, COVID-19 has been here for a year. In the beginning, and when in March and April, when it first came about, we were very strict with the face mask, the social distancing. Everybody worked from home, and we're almost a year ahead now, and we are still putting in place. We're still adhering to government protocol in terms of masks, social distancing as much as possible, but also people becoming a bit more lax, and even the reporting on the COVID-19 deaths has become almost a bit normal. How do we prevent, or how do we not normalize COVID-19 deaths and create a stronger consciousness about the fact that COVID-19 is a disease that can potentially kill, and also in Africa that is the case? What would be
with members of the public? And as Africa CDC, we provided guidance and guidelines on keeping the information flowing, because as soon as there is a gap, then information from unverified sources will come, and most of them come with information that is half truth or sometimes a complete and total lie. So communication with the public has to be constant. And what we need to inform the public is that one, the strict measures in the beginning were extremely useful. In fact, if we didn't do that, the numbers in Africa would be crazy today. But because there was such strictness in the beginning, it kept the initial numbers low so that information could be able to go out to the public about how they could be able to protect themselves. So now the laxity that we are seeing really needs to boil down to enforcement. And enforcement is not punishment. Enforcement is supporting each individual to be able to realize what their responsibility to themselves and those around them actually are. And when people understand that they can be able to continue earning a living while observing certain public health measures that cost nothing, but the benefit is not being sick, the benefit is not dying, then that communication, if it is packaged in an appropriate way, most human beings will be able to respect it. But we also must appreciate the fact that there is a bit of pandemic fatigue, if you want. But we should not get tired. And this, I think, is a message that needs to go out to the members of the public, that they are the ones who are going to be able to break the back of the pandemic if they're doing the right thing. As soon as you start doing the wrong thing, you expose those who are vulnerable, and then the virus continue to circulate in the population. So it's an issue of messaging, and most governments in Africa have been doing a fantastic job. We must raise our hearts to them, and that is why the numbers in Africa have remained relatively low when we compare with the models that have been given in the beginning and when we compare with other parts of the world. It is not yet time to ease ourselves like, yeah, virus is gone. This virus is going to be with us for quite a while, and we must be able to live with the new normal of ensuring that we are following the well-proven public health measures that governments in Africa have been putting in place.
very, very clear? Constant communication and clear messaging. That's what I get as the main key points. Thank you so much. We'll get back to you in the formal Q&A section of the webinar. For now, I want to say thank you very much. We go to our next speaker. I can already see her, Dr. Mwangangi. Dr. Mwangangi is the Chief Administrative Secretary at the Ministry of Health. In this role, she supports the Cabinet Secretary, which is like the equivalent to the Minister of Health, in providing oversight and stewardship in the implementation of health sector policies and building collaborative partnerships with a diverse range of stakeholders. She plays also a key stewardship role in Kenya's risk communication strategy in the fight against COVID-19. Karibu sana Daktari. I'm looking forward to getting some, because we've been on the African continent. Another question, participants, kindly fill it in. From a national public health perspective, we've heard on the continental level from WHO, from Africa CDC, but for you as a Ministry of Health, the first question I would like to know, looking back at the past year, what were some of the smart questions or smart choices that your ministry made to contain the pandemic so far?
Thank you, Kibacha, and thank you to my fellow panelists. I'm pleased to see familiar faces and can I say some of the champions who really have supported us even at country level as we roll out our COVID preparedness and response measures. I think for us, one of the key lessons and perhaps one of the things that we can give a green light and tick off as a country is the structure of how we were able to roll out our COVID response. And the key element being political commitment. I concur with all the panelists here and yourself as well, that in the beginning, we had very, very good, should I say, political engagement and commitment. And beyond our president taking charge, that's His Excellency Uhuru Kenyatta, we had perhaps a structure formed that was able to spearhead the COVID response. And one key element of this structure was the multisectoral nature of it. And most importantly, a lot of private sector participation in that structure. And this was very useful when it came to coordinating our responses, very useful when it came to resource mobilization. And perhaps without that sort of cemented structure in the beginning, we definitely would have struggled as a country when it comes to the rollout of the COVID response measures. And it becomes very important also for participants to understand that Kenya is a country that has what we call devolution of health services. So we have the national government playing a policy role, and we have devolved what you'd call counties or states, much like the American system, that then have autonomy when it comes to the response against COVID-19. And so having this structure, having this institution, framework, particularly at national government, and the same replicated at county government was absolutely essential, and what I would call a definite smart choice when it comes to rolling out, response measures that require, I think for the first time, very, very rigorous grassroots efforts. And that's what we were able to, tick and give a green light in the country. I think another important component would be, should I say, the agility to really respond and use social infrastructure beyond the health system. As you're all aware, one of the measures that were important in the beginning of the pandemic was quarantining and contact tracing and isolation facilities. And of course, most countries struggled with having this infrastructure in place in the health sector in of itself. And so Kenya was quickly able to adapt to infrastructure that's available in the education system. We're able to use some of our schools as isolation centers. We were able to use and partner with the private sector when it came to hotel facilities, conferencing facilities, and quickly come up with a mechanism in how we'd be able to isolate, members who needed isolation or those who needed quarantine. And this was very, very useful when it comes to rolling out of our response. I think another key element which we really appreciate in Kenya again was perhaps the role that partnerships played when it came to the COVID-19 response. One of the key things that we did when it came to resource mobilization beyond putting in place resources from Exchequer was actually finding mechanisms through which the private sector, and this is outside of health, can contribute to the response. So Kenya actually had what is known as a COVID-19 fund, and this fund was a collaboration of private sector players, particularly those in the finance space. So we had bankers who engaged with us. We had financing institutions who were able to bring money together, put in what we'd call a basket fund, and be able to roll out and resource mobilize a response. And this was very, very useful for us. And I think went a mile away in showing how partnerships can work. Another key element I'd say perhaps would be the agility also to develop solutions that were needed for COVID-19. Very quickly, we were able to look at IT resources that were required and to deploy them. I must share an interesting story. In the beginning of the COVID-19 pandemic, we actually partnered with the Ministry of Transport to quickly roll out passenger manifestos that were utilized when it came to contact tracing, when it comes to public transportation. And this is sort of a mechanism that was under development, but within literally a month's time, this was deployed and provided great utility when it came to contact tracing in the country. And so in terms of smart choices and what we got right, I would say one, particularly having very good political commitment, putting a structure for that commitment to be then implemented. And then of course, leveraging on the different social infrastructure that we have in the country was very useful, and leveraging on partnerships and perhaps for the first time even designing frameworks where public and private resourcing can come together towards a cause. That has never happened within the country beyond PPP frameworks, and that is something really that we're proud of as a country. And of course, like many countries in Africa, we did well when it came to local manufacturing. We were able to quickly get our industries producing PPEs, and perhaps really a very, should I say, resounding lesson when it comes to self-reliance in the country. So those are the good things. That's what went right when it came to COVID-19 in Kenya.
So now the next question: what were some of the difficult choices that you as a ministry had to make in order to work on the pandemic?
Thank you. That's a good question, and I'm pleased that we're here together, particularly with the private sector. For me, one of the key things that, was a challenge and perhaps becomes something that we need to leverage on for future learning would be the whole management of supply chain. So yes, we did well and we got local manufacturers making PPEs, but then we had some resounding questions and echoes. For example, could we have better engaged private sector providers? So I'm talking about the hospital providers. Could we have better engaged them when it came to the procurement of some of, the commodities that were required for the response? And I'm talking about lab reagents. I'm talking about some of the non-pharmaceuticals that kept on running out and, stocking out both in public sector and in the private sector. And perhaps this would have been an opportunity for us to come together, find mechanisms, much like the COVID-19 fund that we had for resource mobilization, find mechanisms through which a grouping or a consortium of private sector hospitals and providers can actually come and layer on their resources with the public resources and ensure that we got the reagents in on time, and therefore, of course, expanded our testing capacities, making sure that we, reduce the stockouts, which of course at some point did hamper the response. So for me, it brings then a very important question when it comes to procurement and supply chain management in Kenya and perhaps even for Africa. And I know most countries do have central medical stores that are involved in procurement. Perhaps this is a day and age where we think of, opening a window in those stores that can actually facilitate private sector procurement, leverage on the economies of scale, get better prices, and make healthcare more affordable. So that's something that I think we learned as a country. I think, of course, then the first panelist today from WHO was able to talk about continuity of health services. I think most countries heavily invested in the COVID-19 response, and perhaps 3 months into the response, we realized a slipping in our indicators when it comes to immunization, when it comes to family planning, when it comes to HIV and TB. And so then it becomes very interesting for governments for us to be able to put in place systems that enable us to have all the balls in the air, even when we have an emergency and crisis at hand, as COVID-19 was or continues to be. And so one of the key things that we realized early on is that even as we mobilized resources beyond financial resources, even as we mobilize our healthcare workers to pay attention to COVID-19, the message needed to continue on that we still need to be alert when it comes to immunization. We still need to be alert when it comes to family planning. We still need to be alert when it comes to offering HIV services. And so this was very, very, important and a lesson that we did learn. I must say Kenya has improved dramatically in terms of these indicators. We've seen an upward improvement in terms of the number of children who are fully immunized. We've seen good rates when it comes to family planning uptake. And we are seeing most patients, on enrollment in terms of HIV medication care and treatment. But these were sleeping at a point, particularly early on during the pandemic.
Very, very interesting and insightful. You mentioned the private sector several times, and you also mentioned the multi-sectoral engagement structures that were, smart choices of your ministry to tackle the pandemic so far. Moving forward, as maybe in Kenya we move to a second, third, fourth wave of infection, what would be your asks or your ask of the private sector in Kenya to work with your ministry?
Thank you. I think for us, I must say, at the outset, we do have a very vibrant private sector. Healthcare provision in Kenya is 50-50. So we have just as many public facilities as we do private facilities. And so our engagement has been very collaborative from the outset. However, one of the things that we are learning, and we've had musings on this, with our different partners in the private sector, is it may be time right now as a country to actually think about how we share information better, because that was one of perhaps our Achilles tendons in terms of COVID-19. It became difficult with the disparate information systems to actually get good data that was able to give us good caseloads when it came to COVID-19 testing, but also in terms of our admissions and ICU care, and the whole sort of pathway of care. And, as government, we did have a policy that guides us when it comes to information systems and IT systems. However, when you're in a crisis and, you sort of have your immediate priorities of protecting the citizenry, only then later on did we realize it would have been much easier if we had some form of integrated health information systems. And so my call right now is, as a country, we have a policy framework that's available. It becomes then important to actually have those are conversations when it comes to interoperability between, health information systems, just to ensure, particularly in cases of crisis, that data is readily available, because we know it's crucial to decision making. I think that would be one of the key main asks as we go forward, as we prepare even for future pandemics. Other than that, I think Kenya, was on a good leg, and we continue to fight the pandemic, in great collaboration with the private sector.
Yeah, great, thank you so much. We'll go to the next speaker, but we'll come back to you in the Q&A section. I've seen some interesting questions already that were sent to us prior to the webinar. Another question, kindly fill it in, participants. I see Dr. Ian Barton is already ready to go. Let me introduce you to the crowd, and then we get it started. Dr. Barton is the CEO of the Clinton Health Access Initiative. He is an expert in developing and implementing best practices for global health. And as a committed South African, Ian is a medical doctor with 10 years of clinical practice experience and 20 years in the healthcare business management sector, specializing in pharmaceutical supply chain and market shaping. So we'll go into the supply chain. I'm looking forward to that. As Dr. Mwangangi also mentions, private sector supply chain challenges. Ian's most recent role before joining CHAI has been as the Executive Vice President Healthcare for Imperial Logistics. There he was responsible for the strategy, innovation, and solution design across all of the company's healthcare businesses, and he has driven new market expansion. Welcome, Dr. Barton. Happy to see you here on behalf of CHAI. And as your introduction already shared, you're an expert in the supply chain in Africa's health sector. That I think nobody can doubt that. And as a development partner on behalf of CHAI, you've worked with governments, you've seen many stakeholders throughout the years. And my first question to you would be what would be the best approach for Africa to manage this COVID-19 pandemic? What have you seen has been going on, but also how can the continent best deal with the supply chain management of the vaccine rollout? How to move from vaccine to vaccination? What would be your views on that one?
Well, thanks, Marloes. I'm fascinated to hear you say that that's one. I think there were like 4 in there that I heard. It's been an incredible year. It really has. The 12 months that we've lived through has been an incredible experience for all of us, and an incredible learning for all of us. And very early on in the pandemic, I started using this phrase with my staff and with partners, saying, the only thing that I know for sure is that I will know more in about 6 weeks' time. And really what that was expressing was how fluid the situation was, how fluid the knowledge and understanding was, and the volume of information that was coming at us. And we start off with in the supply chain space, something that I think it was Dr. Mwangangi that spoke about that multi-sectoral response, but there was also this sectoral interdependence that we saw. And the first one that really came to light right up front was the macro impact on supply chain capacity. And there was an incredible shift in the availability, price points, and service levels within the supply chain space for international freight movement. And it wasn't because we were all moving more stuff for pandemic response. It was because we grounded all the passenger aircraft. And something that is really obvious to everyone that travels, but nobody actually points it out, is that the vast majority of air freight on the continent moves as what's referred to as belly freight. It moves as the underlayer of freight movement on passenger aircraft. And one morning we woke up and we'd grounded all the passenger flights. And so that entire space of belly freight disappeared from the goods movement capacity of the marketplace. Now, the interesting thing about the stuff that used to fly belly freight is it was all expensive stuff. It was highly desirable stuff. It was usually high margin stuff. And so it was able to eat up all of the cargo freight capacity because it was willing to pay a higher price. And so all the stuff that was in cargo freight got shifted to sea freight. But at sea freight level, the ports were being shut down in China, and the ports were being shut down on the continent. The ports that were open were running on 50% staff levels. And so the ability to move product was limited even by sea freight. And so the consequential knock-on that happened landed up with the cost to move goods for healthcare response escalating by factors of 6 to 8 times in terms of the price that we were having to pay for air freight and goods movement. And so what does this tell us? It tells us that there's a need for us to be more systems focused in our thinking rather than just healthcare focused in our thinking, that we need to understand the consequential impacts of other things that are happening in our environment. And that needs us to be, as someone else mentioned, alert and agile and responsive. We need to develop levels of collaboration and partnerships that we've never tested before. And it's been amazing to see how well that has worked. And we've seen those nationally, we've seen them regionally, we've seen them globally. I mean, the level of collaboration that's gone on has been quite incredible to see. If we look at the healthcare specific impacts in supply chain, one of the most striking things early on was the lack of regional or even continental harmonization around quality standards for importation management. And so we had great initiatives like the medical supplies platform being set up as an e-marketplace, but every product being listed on there had to jump through different hurdles for different markets, for different countries, because the quality standards and the standards for registration and the customs and excise importation aspects were different for every market. And so there's really big lessons for us to learn about the benefits in standardization of regulation and customs process if we want to have an aggregated buying platform or an aggregated buying power. Also in the systems thing, there was the absence of transparent models of tracking and tracing of product and shipments, and of tracking and tracing inventory levels at country. And so the ability to quickly respond and to quickly reorder was incredibly limited. And so the old style procurement logic of many of our markets in the developing world, of this annual procurement of a big volume of product with a 6 to 9 month order delivery lead time, does not represent the kind of agility that you need to be able to respond in this kind of scenario. And so as we talk about health system strengthening, as we talk about pandemic preparedness, as we talk about the need to create the capacity in our health systems to be able to respond to these kind of scenarios in future, it's going to need us to completely re-gear our thinking around the way in which we actually manage procurements, the way in which we manage goods movement, and the way in which we manage inventory tracking and audit of availability. So that really is the sort of the base thinking from my perspective on the supply chain stuff.
Who would you say needs to, sorry to interrupt, but who would you say needs to take up that role to re-gear the thinking, as you say, in the procurement? Would it be the African Union, or would it be the Africa CDC, or would it be the national governments under their own regional economic blocks, or who do you think needs to take the driving seat there?
Obviously, these things have to come from being national government led. National governments have to examine the situations, understand the implications, and then communicate around what are the alternatives that are being tried and what are the benefits that are being shown. So, you know, we don't need all. One of the great things about the collaborative and partnership environments that have been developed is that we don't have to have everyone learn the same script every time. We can actually have those shared learnings through those structures. And give you a simple example on that, you know, so there was a lot of anxiety in many places around the ultra cold chain capacity for the Pfizer vaccine distribution. And people were really getting concerned about how would they manage it, how would they cope with it, how would they deal with it. And it was Africa CDC who turned around and took the leadership position on it and said, hold on, this is what's there, there's the information, this is how you do it. It will not be able to achieve blanket utilization for an entire country, but if you use it in the following circumstances and in the following segments of your response, it can be a very effective component of your response. And so, yeah, it needs to be country-led, it needs to be country-developed, but it needs to leverage the aggregate knowledge, the aggregate experience, and there will be a need for the authorities like Africa CDC, like Africa Union, like WHO, to provide those guidances around what is recommendations and best practices.
Thank you very much. I know Chai also plays a big role in the supply chain, and also in terms of COVID-19. You have worked with quite a few governments as well. And I was wondering, what are the biggest challenges from your experience that you've seen governments face in terms of the information provision on COVID-19? And what role does Chai play in regards to solving some of the challenges that governments face in this regard?
That's a great question, Marluz, and it really is. It's been a real privilege for us to be able to support a number of governments in their efforts to serve their populations better. And a common theme that keeps coming through is the issue of information transfer and communication. And it was really interesting to hear Ahmed refer to this as well. Yeah, the information flow, the volume of information flow is unprecedented. And you hear this term being bandied around, the infodemic. Well, the infodemic is not just happening at the to consumer level, it's happening at the to policymaker, to government level as well. I was reading a great article by the WHO's chief scientist, Sumaya Swaminathan, she published it in Nature in December. And she was talking about the scientific review group that she's put together in order to try and filter the data that is coming at the WHO around COVID response from around the world. And they put together this group of a few dozen volunteers to assess and evaluate the published content, not just the rumored content, the published content that is being made available. And they're having to manage more than 200 items per day. Wow. That is coming at them in terms of information flow. And what they have to do is they have to look for the duplicates, they have to look for the redundancies, they have to look for the spurious, and they have to be able to filter and parse for the impactful and the important. And they then have to communicate that out. And so the information flow to governments in terms of policy, in terms of practice, in terms of procurement, in terms of practicalities, is voluminous in the extreme. The communication ex-government to their national population is absolutely vital as well. And it's not only to the patient base, it's to practitioners. It's to the system managers within the government system. To roll out a vaccination plan across a nation requires a level of coordination from the law enforcement all the way through to cleaning services and medical waste management. It requires a communication and coordination across a myriad of individual role players. And it's really important that information is kept factual, that it's kept simple, that it's kept relevant, and that it's kept current. And that it needs to be proactive and it needs to be voluminous in its delivery so that people are able to hear it. And it needs to use the channels that people are listening to. And I think that's one of the most important things that we've seen people look at, is to look at how to get the message out and what channels of information are being delivered. But there's always going to be the people who think it's more interesting or sells more, gets more clicks and more eyeballs, whatever the current term is, to be able to put something out there that is contentious or conflictual. And the only way that, is that old saying, in the absence of information, we jump to the worst conclusions. And so the only way to actually overcome that is through high quality volume of proactive information flow. And that's what we've seen a number of countries move into, which is really, really interesting.
Yeah, I think I've heard communication come back from you, from previous speakers before you. I think it's key. I think we can all start a whole session only on communication during COVID-19 and the impact it has on policy, on the public, on budgets, on procurement, on everything. I think communication is key. You hear it a lot, but I think in this case it really is. In terms of communication, we'll move to the next speaker, but we'll get back to you, Dr. Barton, in more Q&A from the participants. These were my 2 cents that I wanted to throw for your feet. But let's move to the last but not least speaker of today, Mrs. Ruth Fields. Ruth, welcome. Ruth is the Market Access Director at AstraZeneca, and she's based in South Africa. She leads the strategic direction of AstraZeneca's access strategy for the portfolio, which includes health economics, pricing, reimbursement, as well as government affairs. During her extensive, more than 25 years experience in the pharma industry, she has worked in different high-level positions for different companies like Novartis, Abbott, Eli Lilly, Merck, and there she's been responsible for relationships, processes, and projects within multiple different African countries. Welcome, Ruth. It's great to have you here and to have the voice of the private sector. We as AHB always pride ourselves with the fact that we promote the private health sector on the continent. And it's great to have a private sector player here also in the panel of the big boys like Africa CDC and WHO and the development partners like CHAI. So it's great to have you here as well on behalf of AstraZeneca and the private sector. You know, we always hear that it's the public sector's role to provide equitable and accessible healthcare, but as we heard also from Dr. Mwangangi, the private sector also plays a significant role in some countries, even more than 50%. And on behalf of AstraZeneca, what is your approach when it comes to ensuring broad and equitable access to vaccines in Africa? Because Africa, you know, AstraZeneca is one of the key vaccine providers globally. And what is your approach in making sure that your vaccines reach the people that it needs to reach, basically?
Thank you very much, Marie-Rose. So what we did is AstraZeneca, we looked at a multi-pronged approach. We decided to manufacture the vaccine at scale for broad access, and also we managed to make it equitable as well. We decided that one of the things that we had to do was to actually partner with governments and private sector. However, we wanted government to actually be the one that is in the lead as far as the vaccines are concerned. And we wanted them to source the funding and negotiate for respective countries' agreements and distribute the vaccine. Why did we do that? We did it because we wanted to make sure that it actually reaches the higher risk people much quicker, but also we wanted to make sure that it doesn't go to those people that have got more money at the expense of those that really need it. And the other thing that we thought in terms of government as well is that if they are the ones driving the process, it will be easier actually to collaborate with all the other stakeholders because they actually usually are the ones that have got access to everybody. And we wanted to make sure that this collaboration is with all parties because for COVID-19, for example, if you look at the vaccines needs to cover the entire population. And at the moment, we don't have enough supply. So as a result, you require multiple vaccines. It's not a nice to have, it's an essential medical intervention. So it's not about saying, okay, these are my competition, I shouldn't actually have them in the market. It's about saying, how do we work together? And the other thing that we had to look at was to say, how do we partner with the multilateral organizations? We were the first company to partner with COVAX. We are going to be providing more than 1 billion vaccine doses through COVAX globally. 60% of the supply is going to low and medium income countries. We wanted to prioritize those because that's where the greatest need is most of the time. And then we also partnered with other partners like your Serum Institute of India that are major global suppliers in order to be able to supply multiple countries at the same time. Negotiations with the African Union are still going, as you know, but we needed these kind of stakeholders that actually will give us breadth and depth. Reach had to be quicker and more comprehensive because actually this thing is spreading very quickly. The other thing that we looked at was also the clinical trial development. For us to have all this, we need to have clinical trials actually developing at a much faster rate than in the past. We had to be agile. We needed to be swift on our feet. we had to expedite the clinical trial development, but still ensure safety and also make sure that there is efficacy with those trials. So what happened at the regulatory level as well was to make sure that there are rolling reviews that were in place, and so that data could be evaluated as it came through. That has not really been the norm in the past. And this was all subject to criteria that was put in place. So clinical development with AstraZeneca is still going, and we're adding more and more clinical research sites to test the vaccine globally, because obviously this is much widespread in the entire world, but at the same time, we're seeing a lot of variants coming in as well. So more studies need to be done. The other thing with this equitable access as well was to make sure that we expand the supply partners as well. You see that we are adding more and more of these supply chain partners that will manufacture the vaccine as well. So it's about more, it's about bigger, but also getting everybody to get the vaccine, rich or poor, but at the same time prioritizing those people that are at risk.
Okay, that's very clear. You know, working with governments, with private sector, government in the lead to make sure that those who really need it will receive it, not based on how much money is in their pocket, basically. Working and partnerships again, we see it coming throughout the session. Partnerships, communication are some of the key trends that come up. Now I want to shift a bit to another type of discussion. How does a multinational company like AstraZeneca deal with the changes? We've heard the new normal in terms of remote working or internal processes with your staff, but also how does a company like yourself now deal with engaging external stakeholders like distributors, hospitals, or even patients? What have you implemented in the past year that's working very well and abides by the new normal, the social distancing, and all that comes with that?
So at the backbone of this, I think the one thing that we had to do was to learn to deal with uncertainty and to equip our employees to basically deal with that. Because this was like being confronted with the true uncertainty of human existence and the true vulnerability of human life. Because most of the time we come to work, it's a normal thing. You assume that you're just going to go back home and everything will be normal. Now, all of a sudden, the employees are scared to come to work because they are scared that they may actually get infected. They are being, there's now risk. And then there's other things as well. The same employees, they've got children that are going to school. They've got a fear of those children going to school because when they come back, they might come back with the virus. And there's a whole lot of things. Now they are not doing what they were supposed to be doing most of the time in terms of the activities. And some of them are stuck at home because they've got comorbidities or they've got small children. So they really can't come into the office. So that was also like having to look at the more human level, at the more individual level, instead of just looking at day-to-day work. And also now trying to work out with them as well to say, what is truly important for you? And what is it that you need to pursue at that particular time? Is it being at home and working with your child so that the homework is done? Is it also making sure that probably you look after your elderly parents who are also at risk, but because you're looking after them, you can't really come to work and have that flexibility in terms of the way they work. So you will also see that because of that, we've moved quite virtually. So we're doing a lot of things on a virtual platform. So 60 to 80% of the time, most of the people are working from home. And then for those people that are coming into the offices, we've made sure that the place is as safe as we can make it. So we've provided sanitizers everywhere. We've made sure that the place actually gets sanitized all the time. And we've made sure that the social distancing, most of the people are working at home. Most of the offices that had a lot of people in there, you see 1 or 2 or 3 people during the week. So it's not a lot of people. We've also put a lot of screening in there as well, but we've also made sure that in the meeting rooms, there's only a certain number of people that are there as well. And the other important thing that we have to do was to make sure that people are not scared to stay at home, because sometimes people feel that if they don't come to work, they may actually be penalized, or the next retrenchment is going to find them being gotten rid of because they were not coming to work. So it was about dealing with that as well at an individual level to make sure that they realize that what is important is to know that they're uncomfortable, whether they're at risk or not at risk. If they feel like they want to stay at home, they have to stay at home. Those were things that internally we put into place. But then the other thing, the external part, because most of our business deals with healthcare practitioners. We do most of our business also with the hospitals, the private sector, public sector. I mean, we are out there. And that's where the greatest risk is as well. So it was also about learning to listen to the customer. If the customer is not comfortable to have you in their rooms, then you don't go there. But also if the customer has got certain rules and regulations in place that needs to be followed, which are in line with the COVID restrictions, you need to also follow them as well. And it was now a different approach. It was almost like saying, instead of looking after me as an individual, then we now need to look after the next person as well. So that was a whole change in terms of thinking as well. And then the other thing that we also saw coming up in terms of this was the value of freedom. In the past, we don't value the freedom of mobility, the freedom to have a meeting externally or internally. All of a sudden, we had a situation where customers are not really allowed to come into the offices to have meetings, and also we're not supposed to go to them as well. So how do you then strike a balance in terms of getting the information that you want to get out there, but at the same time, making sure that you are following the restrictions, you are following the guidelines, you are also making everybody safe in the process, but also bearing in mind that some of our customers are not really computer savvy. And also some of them have never even used digital platforms. How do you then, as a corporate company, help them to make sure that you actually teach them to be savvy and to be comfortable with those kind of things, even though we are not an IT company. So that has been a huge shift. The other thing that we looked at was also the value of essential workers, because in the past, I mean, we know, yes, these are doctors, these are nurses, these are people that are working in hospitals, or these are any other essential worker, but we've never really valued them as right now. So it was almost like saying, how do we then put a holistic package together to make sure that whatever we are doing, we also making sure that those people, they feel that we are helping them. Whatever assistance they require from us, they're getting it. I mean, we deal with medical products. How do we make sure that at any point in time, they are not out of stock? Even when you're not supposed to be there where they're supposed to be, how do we make sure that the patients are adhering to these medications? Because the biggest thing about COVID is fear. People are afraid to go to the hospitals. They're afraid to go to the clinics. They're afraid to go and collect their medications. Not all of them have got door-to-door deliveries. So how do you as a company then make sure that that treatment, that medication gets to them instead of the other way around? So it's been a lot of learning in the process, a lot of agility, making sure that we are swift on our feet. We do things differently, and also make sure that everybody that we're actually working with, we're pulling them along as well. Because most of the time, as the pharmaceutical industry, we're quite far ahead in terms of digital platforms, in terms of innovation. But some of our stakeholders are not as far ahead. So how do you then pull them along? So that is what we've done. But I mean, it's really worked very well. And I must say that the pandemic has actually been a blessing in a way, because it has actually fast-tracked some of the things that we'll not have been able to do probably in the next 15 years. We're able to do them now.
Yeah, the situation forced people to maybe move quicker to the digital space and engage more with you in that regard in order to be safe and all that. Thank you very much. It's been very insightful. I know there are more questions coming to you from the participants. Thank you very much for now. I want to thank actually all the speakers. We'll move to the general Q&A section now, and we will go over several questions that have been shared by participants in this session. And let me see. Of course, we have received actually a lot of questions, and we will not be able to go through all the questions in this session. We have about 15 minutes left. So please don't be disappointed if your question is not being taken care of in this session. But if it's relevant and it helps, and it's towards supporting the discussion that we have been having today, it will be definitely included in the conference or in the session report afterwards. The first question I have is for Dr. Mwangangi. Somebody's asking, what are the measures that are put in place in Kenya for the continuous surveillance of the circulating genotypes of the virus in Kenya? Dr. Mwangangi, please take it away.
Thank you. So, you know, with the advent of the new variants, you know, in the different countries, it's become important for different countries to put in place surveillance mechanisms, particularly when it comes to genomic sequencing. And I think one of the things that Kenya was quickly able to do is to partner with local research institutions. I must say, probably after our first case, I'd say 4 weeks in, we already had done genomic sequencing of the COVID viral strains that were in Kenya at that time. And so we already had some infrastructure, particularly in R&D institutions in the country. We've expanded this, gone beyond the health sector, and we're now working with the Ministry of Agriculture, leveraging on the infrastructure that exists in the livestock research centers to continue putting in place genomic sequencing activities. And these have been fruitful. We have been able to, you know, capture and identify 2 of those strains and contain them in terms of, you know, contact tracing and quarantine and isolation. And so we have an elaborate framework, and I must thank Ahmed, who is on this call, because we've also engaged with Africa CDC, and they've been able to also give capacities and build capacities when it comes to genomic sequencing. And it's a continued collaboration, particularly with our laboratory infrastructure across the country, to ensure that we have good surveillance mechanisms. So that is something that I think we've done fairly well as a country, particularly because this investment was already there in Kenya.
Great, thank you very much. And it's good you mentioned Dr. Ogwa, because actually the next question is for you, Doctor. Somebody's asking, are there any African countries working on their own vaccine trials? And if yes, is it promising?
No, thank you. Thank you very much for that question. Indeed, there are countries that, I don't want to name countries now because a lot of this is bilateral, but there are about 10 or so countries that are now started and are doing bilateral arrangements, which means that we as Africa CDC and the Africa Union, we have not been involved. In as far as the type of vaccine is concerned, there are those that we have already looked at the data and we are happy with, and those include Pfizer, AstraZeneca, Johnson & Johnson, and others are going to join as we study the data. Outside of the ones that have been approved by COVAX or ourselves as the Africa CDC, we cannot be able to say much about those. But there are countries that have started vaccination, about 10, and 11 with Ghana, which is getting its vaccines from COVAX, and we expect more will be able to start vaccination as the vaccines that we procured start coming onto the continent. And the 3 different sources of, in fact, there are 4 different sources of vaccines. One is a bilateral arrangement, 2 donations that are coming to some countries onto the continent. 3 is COVAX, and 4 is what Africa CDC, Africa Union is actually securing for the continent.
Interesting, and also interesting that you mentioned that there are 10 studies or vaccine trials are going on in the continent right now. How great would it be if we have a African vaccine that will travel the world? And you know, Pfizer, AstraZeneca, and I'm happy you're here, but how great would it be if there's an African-owned manufacturer and research vaccine that will conquer the world? Fingers crossed for that. I think we're on the right track. Yes. Dr. Barton, my question will be for you. We spoke a bit about communication, and somebody is asking here, which I find a very interesting question, and I think you'd be a very perfect person to answer the question. What value do we attach to the many conspiracy theories on COVID-19, considering some theories have proven true in the past?
Yeah, I think I made the comment earlier that in the absence of information, we jump to the worst conclusions, and there are always people who are willing to try and tout the sensational over the factual. Yeah, so I would just stress again that, you know, one of the things we've learned out of this pandemic is that informed patients are very capable. They're very capable of self-testing. They're very capable of self-management. They're even capable of self-triage. And we have to ensure that the information flow is factual, it's understandable, and it's relevant. and it's relevant both in its source and in its content. And yeah, I think there's been plenty of opportunity for people to make money and returns out of the uncertainty and the insecurity that's existed in the marketplace. And we saw lots of that around PPE. We even saw some of that around antibody testing and the use of antibody testing in the early days of the pandemic. And so I think it's incredibly important that we make sure that patients are empowered through high quality information that is not only in the right places so that they can get to it, but that it's continually supplied and that it's continually updated, and it's represented in an understandable fashion, in a language and in a manner that it's possible for people to actually assimilate.
Yeah, I think the understandable fashion is the key. You know, what means something to one can mean something different to somebody else. So how that message is conveyed and understood is also a second thing. Thank you very much. I have a question for Ms. Field. And on behalf of private sector, what has been the private sector's most significant contribution in supporting the management of COVID-19, according to you?
So the biggest thing was to actually make the vaccines available globally. That's a very big contribution from us. And also in terms of supporting the governments to make sure that they are able to access those vaccines and also implement them in the respective countries. The other thing that we also did very well was to help in the dissemination of clinical information to wherever it's required, whether it's the regulatory bodies, whether it's actually the healthcare practitioner networks or the individual healthcare practitioners, and also to support the digital platforms for most of these stakeholders, because some of them, they didn't even have digital platforms. So we made sure that we supported most of them as well. And the other thing was to also ensure that we support the healthcare practitioners with the other non-communicable diseases as well. Because even though we've got COVID-19 at the moment, but cancer is still there, diabetes is still there, all the other diseases are still there as well. So you don't want the people to actually be safe from COVID-19 or be managed well from COVID-19, but they are dying from the other diseases as well. So we've done a lot of work to make sure that at the end of the day, we give a holistic support to whoever needs it.
Great, thank you so much. I'm looking at the time. We have 6 minutes to go. I see we have a lot more questions, but as I already indicated earlier, unfortunately, time is not on our side. So we will take up your questions. Our team is on it, and we'll make sure as much as possible that your questions will be answered, and we will share the answers with you as well through the report that we are preparing after this session. I want to move to the poll results. Let me see, what is the outcome? The first question we asked are, which of the following lessons learned is key to overcome the pandemic in Africa? So let's see. Quite spread. The highest response is to the heavy focus on prevention better than cure, but it's followed quite slightly by the continental strategy and by the partnerships. And I think the two are also could be interlinked, because on the continental level and in the strategy, you need partnerships to move. The lowest response is to the increased governance and transparency. So it's an interesting outcome of this. The next poll question that we asked was, how should we accelerate the vaccination program for Africa? Well, this is a clear winner, using a mix between public and private-led, market-led authorization initiatives. So we have one government official here, so to say, Dr. Mwangangi. You see the results of the participants. Let's find a great mix for public and private sector, at least in Kenya, but also in other African countries, to collaborate and to vaccinate the majority of the population. The next question. To maintain economic resilience of African countries, should the continent allow travel only when the traveler has? The majority answer is both a vaccination certificate and a COVID negative test. So the majority is for better safe than sorry. If that means you need to have both, let's do it. The economic resilience needs to continue, and travel needs to be made easily available, but not at all costs. So vaccine and in relation with COVID test is key. The lowest response is to none of the above. The traveler should just be allowed to travel within limitations. There are the only few agreeing to that one. So interesting results. I think those were all the pop-up results that we have so far, that we have in terms of content. Yes. Then I would like to share or give the floor one more time to the speakers for their parting shots. Unfortunately, Dr. Ngoy and Dr. Mwangangi had to leave because they have other meetings scheduled right now. But Dr. Ogwell, kindly share with us in maybe 30 seconds your parting shots following this session.
I will say two things. One is that public-private action is essential because we are serving the same population. And the second thing I will say is that every initiative, every action, whether it is public or private driven, must be within the regulatory framework of a country for safety of the public and efficacy against COVID-19. Thank you.
Very clear. Thank you very much. And then I see him already ready. Dr. Barton, what are your parting shots in about 30 seconds?
Marloes, it would have to be that we mustn't forget the other things that need to happen in addition to vaccines. Vaccines are going to take a long time to roll out. The oxygen gap and the ability to keep patients alive as they fight the infection is an absolutely essential component of this. And pre-COVID, only 17% of facilities in our markets had access to pulse oximeters, and only 42% of those had actually access to free flow of oxygen. And we need a lot more than that now in COVID, but we'll also need at least that after COVID is dispatched to the history books. And so we need to be, as we're building these strong systems, considering the manufacture, the supply, the skills, the equipment around bridging that oxygen gap.
Great. Thank you very much, Dr. Barton. And then we save the best for last, the lady who might be closing the content part for so far. Mrs. Field, what is your 30-second parting shot?
So for me, this pandemic is not really going away, and it's not the only one of its kind. So I really advise that governments should actually develop the systems and strengthen them as quickly as possible, so that we are ready whenever there's a pandemic. And also we need to make sure that our people are ready and empowered as well, because as we all heard, empowered people, they are more able to take care of themselves. The people should not be shifting the responsibility to government or vice versa. They should actually be taking care of this and becoming part of the solution as well.
Great, thank you. Individual responsibility is also key in this one. I want to thank all speakers for today. I think we could have talked on for hours and hours, because on this topic and with such interesting experts and insights, you are never done talking. But unfortunately, the clock is only 1 minute away till it's 5 o'clock here in Kenya, which means the end of the session. I want to close the session therefore, but not before thanking our event partners, which are our sponsors, which make this event possible. BD, Medtronic Foundation, Astral, Area, and Unizima. Thank you for coming on board already at the beginning, at the first, or actually before the first session of this year's webinar series. We welcome other partners also to join the discussions and to showcase their experience and their broader health sector views and experience in the more sessions to come throughout the year. That brings me to the next slide of the next session that we're going to have. Exactly to date, 1 month from now, 25th March, same time. Different Zoom link, but when you register, you'll get the Zoom link. It's going to be about health business investment in Africa. Moderator is, to many familiar, our executive chairman, Dr. Tucker. But we also have key speakers from different sectors within the health space, investors, but also investee companies. So if you want to learn more about the health investment space in Africa, please sign up for the March event. And also go to our website, africahealthbusinesssymposium.com, for the whole program that we have throughout the year. About every month, 6 weeks, we have a plenary session like this one lined up with key speakers. I'm very proud that we had this first session with great speakers like yourselves, Dr. Barton, Dr. Ogwell, with Dr. Mwangangi and Dr. Ngoy, and with Ruth in the team. I'm very honored to have been able to moderate this session, and you've taught me a lot, and I'm sure all the participants in this session also walk away from this session very enlightened. So thank you very much. I think that was all from my end. We are 1 minute over time, but I think that's okay. So thank you very much, everybody. Take care. Be safe. Keep social distance. Wash hands. Prevention is better than cure. Oh yeah, this is me. In case you want to know more about AHB or working with us, feel free to reach out to me or our team. We are happy to engage with you. Partnerships and communication is key, and that's what we at AHB are also for, with giving the right insights as well. So thank you, everybody, and be safe.